Let's talk about vital signs. Vital signs are one of those things everyone in healthcare should know. Not only should you know the normal ranges, but you need to know how to interpret those findings. So let's go over it. A normal blood pressure is 120/80. Now, everyone has their own baseline vital signs, but the NCLEX and nursing exams have to create a gold standard. So a normal blood pressure, according to the NCLEX, is 120/80. When blood pressure is low, we call this hypotension. And when blood pressure is high, we call this hypertension. This is easy to remember because hypo means low, and hyper means high. So hypotension means low blood pressure and hypertension means high blood pressure. Okay, next is heart rate. The normal heart rate is 60 to 100 beats per minute. Now, again, this is the normal for the NCLEX. For example, if someone's an athlete, they might have a normal baseline of 40 or 50 beats per minute. But again, we have to have that gold standard. A heart rate of less than 60 beats per minute is called bradycardia. And a heart rate of greater than 100 is called tachycardia. Something you must know in nursing school is that brady means slow and tachy means fast. And cardia means relating to the heart. So cardia, think heart. So you have a slow heart and a fast heart. So the heart is beating slow and the heart is beating fast. Next is our respiratory rate or respiration rate. A normal respiratory rate is 12 to 20 breaths per minute. Again, we see that brady and that tachy. So brady means slow and tachy means fast. But whenever you see PNEA, you want to think of the lungs. So brady means that you have a slow respiratory rate and tachy would mean that you have a fast respiratory rate. Next is our temperature. A normal temperature is 97.8 to 99 Fahrenheit in an adult. Again, we have that hypo and that hyper. So hypothermia is less than 95 and hyperthermia is greater than 104. This would indicate the patient has a fever. Next is our oxygen levels. A normal oxygen saturation is 95 to 100%. But note on the NCLEX that COPD patients are expected to have lower O2 levels. This can be as low as 88%, and this would be considered typical and expected. When you have low levels of oxygen, you want to think hypoxemia. The tissues are deprived of oxygen. Okay, next is pain. Yes, pain is a vital sign. Even though it's subjective information, it's still considered a vital sign. This can be measured in numerous ways, but the most popular one known is the Wong-Baker faces, which look like this.